wonder what happens when you put someone who does not believe in vaccines, who's totally against it, which is their personal prerogative. But you put that person who believes in his own research, doesn't believe in the scientific data that's been around for a while, and you put him at the head of health and CDC. I wonder what you get. You get shit like this. This article was done December 16th, written by Sarah Braun, and it is from The Guardian. CDC ends recommendation for all United States newborns to receive the hepatitis B vaccine. Wow. The change marks an abrupt end to a 30-year establishment of medical guidance. 30 years. Follows a vote earlier this month. The U.S. Centers for Disease Control and Prevention on Tuesday ended a long-standing recommendation that all U.S. borns receive the hepatitis B vaccine. The agency's move follows a vote from the Health Secretary Robert F. I'm starting to believe that the F stands for fucked up. Kennedy Junior's vaccine advisory panel that a birth dose should only be given to newborns whose mother tests positive for hepatitis B or worse, or whose status is unknown. The CDC will now advise parents to consult a healthcare provider to decide whether the infants born to hepatitis B negative mothers should get the vaccine, including the birth dose. We are restoring the balance. Doo-doo. Really? You on my hair. We are restoring the balance of informed consent to parents whose newborns face little risk of contracting hepatitis B. Acting Director of the CDC and Deputy Health Secretary Jim O'Neill said in a statement, if parents choose not to vaccinate their newborns at birth but feel vaccination is warranted, the agency now recommends that they wait at least 2 months to get the child a first dose of vaccine. If parents choose not to vaccinate their newborns at birth but feel vaccination is warranted, the agency now recommends that they wait at least 2 months to get the child's first dose of vaccine. Oh, God. The policy change marks an abrupt end to 30 years of established medical guidance. Since 1991, U.S. health officials have recommended that universal vaccinations for infants against hepatitis B with the first of 3 shots administered right after birth. Experts have voiced concern around the policy change, which the CDC describes as individual-based thinking. This is going to lead to an increase in preventable infections among children. Michaela Jackson, Program Director of Prevention Policy at Hepatitis B Foundation, told The Guardian. After the vaccines advisories vote earlier this month, she anticipates that parents are not going to know who to trust any longer. And I think that's his whole point. Seriously, because this man is so anti-vax, it's not even funny. Jackson also said that the policy change is removing choice by causing barriers to access. The agency's recommendation affects U.S. health insurance coverage and play a key role in assisting physicians who are choosing appropriate vaccines for patients. Hepatitis B can lead to serious liver disease and is primarily spread through blood, semen, or certain other bodily fluids, and can also spread by close contact with people who don't know that they're infected. Hepatitis B infections have fallen nearly 90% in the U.S. from 9.6 per 100,000 individuals before vaccination became widespread in 1982 to about 1 per 100,000 in 2018. Experts warn the new recommendation, which the CDC described individual-based decision-making could expose more children to harmful viruses. It could lead to more families opting out of vaccination in the absence of a firm federal policy in place. Kennedy is a longtime anti-vaccine activist who has made far-reaching changes to the vaccine policy. Dr. Emily Landon, an infectious disease expert at the University of Chicago Medicine, said the CDC's advisory panel's job is to help clinicians interpret piles of science and help them make good decisions on how to care for their patients. This recommendation is ignoring the science. The fact that the acting director of the CDC was signed onto this just continues to reinforce that they are no longer committed to science-based recommendations for improving health. Like, wow. I just want to sit here and thank all the people that voted with their racism and ignorance instead of, just doing the basic research on their candidate. See, here's the thing, people. You don't have to change parties. This is my personal opinion. You don't have to change your party. If you're a Republican, you can stay that. If you're a Democrat, you can stay that. You're independent, you can stay that. There are times that I've changed my party due to the fact of me living in a certain area trying to get certain jobs because your voting records are public. Anyway, it's a long time ago. But here's the thing. No matter what it said I was registered under, I've always voted for the candidate that aligned more with the values and policies that I believed in that would be for the betterment of not only myself, for the country, period. Like, I don't believe that, people should starve. I think that veterans should have funding, so on and so on. But it's wild to me that, goddamn, like, we put a stone cold kook at the head of, like, all the health. Someone who is widely known for not believing in the freaking scientific data. This is a ex-heroin addict, college dropout. I'm going to say it again. College dropout. This dude is not a scientist. This dude is not a doctor. Fuck. But this guy is in charge of making decisions so far at the top that can change what vaccines are given, if any at all, to your infant when it's born. Like, fucking. Oh my God. There was another one. I can't. I really can't. All right, this is the one that I wanted to read. This is Public Citizens, December 19th. CDC should not have funded problematic Guinea-Bissau hepatitis B study. The Centers for Disease Control and Prevention awarded a single-source, unsolicited $1.6 million grant to fund the University of South Denmark to conduct a 5-year study of the optimal timing and delivery of monovalent hepatitis B vaccinations on newborns in Guinea-Bissau, a country in West Africa. The Danish researchers, according to Stat News, have ties to Tracy Beth Hoeg, a top Food and Drug Administration official who is also the agency's representative to the CDC's Advisory Committee on Immunization Practices. Dr. Robert Steinbrook, Health Research Group Director at Public Citizen, issued the following statement. Everything is wrong with awarding this unsolicited single-source grant, including the approval process. and to be continued because I'm running out of time.